Hello. First of all, thanks so much for clicking on the link, watching this video, checking your emails. This is a great way for us to get information out to you. We have a lot to cover today, so let's get started. There's been a lot of discussion about how our job sites are classified and if employees are at a heightened risk for contracting the COVID-19 virus. One of the things we want to cover today is how job sites are classified, what those classifications mean. We will then also cover what to do if a job site appears to be or actually has been impacted by a COVID-19 incident. First of all, per OSHA guidelines and the guidance on preparing workplaces for COVID-19, work areas have been classified into 4 categories based on the level of risk. They're as follows. Low exposure risk. Low exposure risk jobs are those that do not require contact with people known to be or suspected of being infected with COVID-19, nor frequent close contact within 6 feet of the general public. Workers in this category have minimal occupational contact with the public and other co-workers. Medium exposure risk jobs include those that require frequent or close contact, like within 6 feet of people who may be infected with COVID-19 who are not known or suspected of having COVID-19. In areas with ongoing community transmission, workers in this group may have frequent contact with travelers who may return from international locations with widespread COVID-19 transmission. In areas where there is ongoing community transmission, workers in this category may have contact with the general public. For example, a school, a high population density work environment, or even high volume retail settings fall into this category. Next up, the high exposure risk categories. These jobs are those with high potential for exposure to known or suspected sources of COVID-19. Workers in this category will include healthcare delivery and support staff, doctors, nurses, other hospital staff, such as admissions personnel who must enter patients' rooms, medical transport workers, and mortuary workers who have been exposed to known or suspected to have been exposed to COVID-19 patients. Lastly, the very high exposure risk jobs are those with high potential for exposure to known or suspected sources of COVID-19 during specific medical, post-mortem, or laboratory procedures. Workers in this category will include your healthcare workers, again, doctors, nurses, dentists, paramedics, emergency medical technicians, or even people doing lab work or morgue workers. As a construction-related company, we have been deemed essential by every level of government and enforcement entity. Because we maintain the infrastructure that allows society to function, it is the responsibility of each of us to properly identify the environment in which we work. We must work to create, enhance, and control our work environment in a manner to minimize risk and to take the appropriate protective measures when in that environment. When administration and/or engineering controls can be applied to lower the risk, they too should be applied. Most often, our construction sites will be deemed medium or lower risk exposure risks. For example, a grocery store open to the public may be a lower exposure risk in back of the store and may be classified a medium exposure risk if working in the retail area. However, if barricades are erected to keep the general public out of the work area, then the area could be lowered to a low exposure risk. If we're asked to enter a patient care facility, we could be entering a very high exposure risk area. Job safety analysis and job hazard analysis is usually created by the work group who will perform the work within a given area. During the time in which COVID-19 is a concern, it's recommended that the JSA or the JHAs be expanded to properly identify the work area's risk category. Members of the work group should have an established protocol to collect and distribute new information, and each worker should be aware of the classification of the area's risk, and all members should be committed to sharing accurate information if or when the environment changes. For example, barricades are just one administration control that can be applied to lower the exposure risk. Wash stations, private portalettes, cleaning supplies, and the means and methods discussed in the video that we released on March 29th highlighted the resources we have made available to lower the risk level. Now note, the OSHA risk levels are directly related to a known or suspected individual with COVID-19 being in that work area. Therefore, a once declared lower risk area could become a very high exposure risk instantaneously if a known or suspected individual with COVID-19 does enter that space. Then the question becomes, what are the procedures to restore the area to an acceptable lower exposure risk area, and how should workers respond? First and foremost, all individuals will be expected to act in a professional manner. Respect, dignity, and professionalism must be maintained throughout the following procedures. Okay, so let's go over the guidelines for all Ion Apex employees to follow if your workplace was deemed to be a low or medium exposure risk, and then it escalated to a possible high or very high exposure risk area for any reason. Or if you're working in a known high or very high exposure risk, and there's a failure in the established safeguards, or the already assumed risk levels are elevated, we're going to do the following. Basically, we follow the procedures as if we were to encounter a chemical or an environmental hazard on a job site. When a credible indicator occurs, remove yourself and your team from the possible high-risk environment immediately. Get everyone together at your predetermined muster point, and take your personal tools with you if your workspace was deemed to be a low or medium exposure risk and escalated to a possible high or very high exposure risk area. If you're already working in a known high or very high exposure risk and there's a failure in the established safeguards or the assumed risk levels are elevated, leave your tools and evacuate immediately. Maintain your proper social distancing and make sure everyone is accounted for. Do not leave the job site until you're instructed to do so. A designated representative from Ion Apex on site will inform the general contractor or other appropriate supervision. Next, call our safety director, Mike Dudley, Brandon Hostler, he's our schedule coordinator, or Jeff Kennedy immediately. Contact your project manager and wait for further direction. You are, of course, being paid to stand down and follow the protocols. Assign someone to collect information from all involved and direct all requests for statements from the media or other outside sources to me, Sean Cox. Do not answer any questions from the media or outside sources or offer speculation. If asked, simply reply, I am not permitted to address those types of questions, but our company representative will be available shortly. Do not embellish beyond this. This is imperative. While this is happening, a company representative will initiate their action steps. A company representative will get there as safely and quickly as possible. Utilize the sanitizer wipes that have been put on your job site and get them distributed to all the employees that are on site. Wipe down your tools while you're awaiting further instructions. Then the company representative will collect data regarding the credible suspicion or the indicator. The company representative then will meet with the general contractor or other appropriate supervision, and our next steps will involve our company representative and the general contractor or other appropriate supervision. Here they will determine the validity of the credible suspicion or the indicator. Remember, in the time of a public emergency, HIPAA privacy rules allow for patient information to be shared to assist in disaster relief efforts and to assist patients in receiving the care they need. Patients may include those known to be contagious and those who may be infected. If imminent danger is present, providers can share patient information with anyone as necessary to prevent or lessen a serious and imminent threat to the health and safety of a person or the public, consistent with applicable laws and the provider's standards of ethical conduct. Remember, your protection is the law of the land and our top priority. You have the right to a safe workplace. The Occupational Safety and Health Act of 1970 was passed to prevent workers from being killed or otherwise harmed at work. This law requires employers to provide their employees with working conditions that work to minimize known dangers. Local health departments are promptly following up on all individuals being tested for COVID-19. This involves a thorough investigation, prompt notification of positive cases, and follow-up with close contacts. For all positive cases, contact tracing is completed by trained public health professionals. This entails a thorough questionnaire from the Department of Health Services to find out whether our confirmed case has been and when their symptoms started, and to look at who they were in close contact with and potentially contagious. Those who came into contact with the individual will be notified promptly by our department and provided guidance and recommendations. We will also provide guidance and recommendations to any place of employment for these individuals. Therefore, determine a COVID-19 medical-related status of an individual who is, or as in the workplace environment, could eventually become public. Receiving this information as quickly as possible is critical and could save lives. There are really three main scenarios if the workplace was deemed to be a lower or medium exposure risk and then escalated to a possible high or very high exposure risk. Optimally, we have a no exposure scenario. The suspicion or the indicator was false and had little or no validity. No additional administration controls or procedures are required. Written notice has been received from the general contractor or other appropriate supervision. The area is deemed clear and to be a lower medium risk exposure risk area. Upon receipt of this written notice, work can resume. A maybe is the suspicion or indicator cannot be verified false or true, and additional investigation or information is required. We will not continue for 84 hours when the area was last infected or suspected of being affected. If it's a yes, the indicator is confirmed to be true. We will not continue work for 84 hours from when the area was last infected or suspected of being infected. And according to a recent study published in New England Journal of Medicine, the virus that causes COVID-19 can live in the air and on surfaces between several hours and several days. The study found that the virus is viable for up to 72 hours on things like plastics, 48 hours on stainless steel, 24 hours on cardboard, and even 4 hours on copper. It's also detectable in the air for 3 hours. 12 hours has been added for additional safety measures. The area is properly cleaned and disinfected, and written notice is received from the general contractor or other appropriate supervision. The area is deemed clear and a low or medium exposure risk area. If 3 events occur within 14 days, the job site should be closed for 14 days. The following will be determining when the workplace was deemed to be known high or very high exposure risk, and there's a failure in the established safeguards or the assumed risk levels are elevated. An example is an HVAC system creating negative pressure in a patient's room was disabled, or property safety procedure was not applied while caring for a patient. The following assumes the facility is deemed essential for maintaining life and the work to be performed is essential to maintaining life. Again, follow the procedures we use if a chemical or environmental hazard occurs on a job site. When a credible indicator occurs, remove yourself and your team from the possible high-risk environment immediately. Call our safety director, again, Mike Dudley, Brandon Hostler, or Jeff Kennedy, immediately. Collect information and establish a new JHA. Only those who understand the risk and volunteer to perform tasks will participate. No one re-enters the space without permission from Jeff Kennedy. If Jeff Kennedy is not available, obtain permission from Jim Wilson and Mike Dudley. No one re-enters the space without the proper PPE, procedures, or training. Also, we want you to protect your families. When any team member arrives home after being in a possible infected area, make sure you wipe down your tools if you have them with you. Wipe down common touch areas in your car, handles, steering wheel, dashboard. Wash and dry all clothing you wore on the job site. Don't add other clothes with it. Use hot water. Dry with a high heat. Make sure to wipe down your boots and then take a shower. Then follow any and all other instruction given to authorities having jurisdiction. Overall, remember, until permission has been granted to re-enter a vacated work area for these reasons, a team member shall not re-enter the area. Do not enter to secure company tools or personal tools. Do not re-enter to retrieve your personal tools. Tools, if need be, can be replaced. However, you can't be. As always, your safety and that of your family is our first priority. And should you have any questions or concerns, just reach out to us directly and we will work with you to get the answers you need as fast as we can. This is a constantly evolving situation and we need you to be our eyes, ears, and responders to manage this threat. Thank you again for all you continue to do and representing the ION Apex team with pride and professionalism. Stay safe. Thank you again.